Let's talk vaccine strategy. Can India vaccinate 108 crore people by the end of this calendar year, by 2021? That's the claim made, that's the hope made, and that is truly what India's recovery, medically, economically, in every way is hinging upon. So now, over the last few weeks, we have seen a surge in vaccination rates. More and more vaccines are being supplied to private centers, private players, and anecdotally also you see more people getting access to vaccines, especially in the 18 to 44 category. But is it an even clip that will allow more people or enough people to be vaccinated? And that's really the question. I want to just go across to some of the questions that the Supreme Court posed today to the central government during a hearing. And broadly, those questions asked, why is procurement by the centre only for those above the age of 45? Why are states paying more for vaccines than the central government? Why is fixing of prices being left to vaccine manufacturers, and hence you have differential pricing? Why are states floating global tenders and attempting to procure vaccines by themselves? The Supreme Court also questioned the digital divide because the CoWIN portal and registration on it is key for anyone to actually get a vaccine. Some of these questions are very key because we have to understand whether the current vaccine policy really helps vaccinate all adults by the end of 2021, and if that ambitious target can be met. To speak on this, I'm joined today by Dr. Giridhara Babu, head of the Lifecourse Epidemiology at PHFI, Dr. Arvinder Soin, chairman of Medanta Liver Institute, Dr. Rajib Dasgupta on the show with us today. He's the head of the National AEFI committee, and Dr. N.K Ganguly, the former DG of ICMR, also on the show. Welcome to all of you, and thank you for speaking with us. Dr. Babu, let me begin with how you see the numbers breaking down at our current pace of vaccination and at the current supply of vaccination. Over the last couple of days, we've seen a lot of claims coming in from Serum Institute of India that it will increase its supply of vaccinations by a great extent. Do you think that we can actually achieve this target of vaccinating, inoculating all Indians by the end of 2021?
Hi, Tamanna, thanks for having me on the show. In terms of the actual numbers, we are not even at the rate of 10 million doses per day. So I'm not completely convinced as of today that we will be able to cover the entire adult population by the end of this year. However, if there are other plans and other supply mechanisms that the government has already worked out, which I'm not aware, I'll be happy to be proven wrong. Minimum 10 to 15 million doses per day is what we require to complete around 300 million people to 450 million people to cover with 2 doses over the next 3 months. So if this is the rate and where we are now, I'm not completely sure how we will be able to cover by the year end, Tamanna. So this is my initial assessment.
Dr. Ganguly, let me ask you for your initial assessment as well, because that at the end of the day, and we'll get into the ups and downs, the pros and cons of our current vaccine policy in a bit, but just on the numbers, how clearly can we trust this claim that we will vaccinate all Indians by the end of 2021? Can we truly hope to? Even if all our might is put behind it and we take the vaccinations to doorstep to Indians, will there be enough supply without a clear idea of how much global supply will come to us? Dr. Ganguly, that question was for you. Can you hear me?
Okay, yeah, I have heard you, but I didn't hear my name. So actually, if we really learn, when there were countries who were good right from the beginning, And there were two areas where we need to watch and see how did they immunize their 50 to 60 or sometimes 70% population. That is Europe, UK and United States. And they took advantage of the same thing, that there was a dip, but they ignored that dip was not really the indicator, which has happened in India, and there was a surge. Then the lockdown happened, and there was a huge surge of vaccination which was taken up, where supply chains, vaccinators, and sites where they were vaccinated were all set up. They were nearest to the people, and communication, etc., were also launched. So here, at this given moment, we should take advantage of that, and as government has said, we should at least try to vaccinate the population, but with a strategy. One of the things which is happening now, the vaccine availability is improving. Both Bharat Biotech and Covishield has production will increase. In another month we will get it. Sputnik already is being distributed. Some of the Delhi hospitals are looking for -80 deep freeze. The AstraZeneca vaccine, which USA had promised, is coming to India. The Pfizer negotiation has gone through. It is coming to India. The negotiation with Moderna, like Takeda is distributing Moderna, they have all surplus production now. So Cipla and Moderna negotiations are on, and very soon that will also be available. And another 1.5 months, Johnson & Johnson vaccine will be available. So we should very carefully gauge that how much vaccine we have, and then make a plan, as Mr. Biden has done, that every state should have at least 3 weeks stock in advance so that they can plan things. And the vaccination strategy should be there, that we should be able to go to the doorsteps to vaccinate. And in the initial stages, I will vaccinate the state where there is the highest surge, and those who really go out much more than others. The next stage, I will also have a strategy to vaccinate the villages, because there also the infection has gone. Finally, I will adopt 2 strategies along with the vaccination, that I will make it easy, so that the street people, the migrants, we have done it in polio. The homeless, they can get vaccinated. So if we have the billboard or plasma screen where we know the center in every city, these guys go and register on the site. They don't have to do from the app. I will also enhance the tracking, testing hugely, because now it is possible, because that should be one of the bulwark, and the surveillance, particularly molecular surveillance, I will put at every corner of the country, at least a sentinel one, where we will be able to crunch the data. The monitoring and metrics and implementation metrics is very, very important. We do not have this as an expert area. I will take third parties help in this, and will do that. And I will also set up independent committee who are not really looking for government jobs or awards or other things, and as it happened in polio, so that they could guide the government independently and provide them a situation. And our data institutes should continuously provide a projection so that the government could shift the vaccination from place to place. So vaccination, vaccines will be available, and other countries have done this, and they have opened up the economy. They have opened up the flights. So this is theoretically, there is a possibility. However, I will go with Dr. Babu's assessment that at this given moment, it looks that unless we actually do the huge numbers, we will not be able to reach that. But theoretically, it is possible. The plan which I unfolded...
Absolutely. We need to change. Absolutely, Dr. Ganguly. We need to change a lot of things. We need to change a lot of things before we can hope to achieve that number. Now, one of the things being talked about, and these are just reports right now, is mixing and matching doses of 2 different vaccines. One other trial balloon that has been floated as well is a single dose of Covishield sufficing. Are those options feasible? We'll take a very short break and come back with more on that. Welcome back. If you've just joined the India development debate, you're bang smack in the middle of the lead story, and we're talking about the ambitious vaccination claim / plan / hope that all adult Indians will be vaccinated by the end of 2021. We hope it happens. It needs to happen. Dr. Soin, Dr. Rajib Dasgupta now also with us on the show. Dr. Soin, how do you think this will happen? How will we manage to vaccinate all Indians?
Well, clearly the goalpost is now December 2021, and we need to get there in 6 months. So if you calculate that we must vaccinate at least 60 to 70% of the population, which means about 90% of the adults, we need to administer about 150 to 170 crore doses. We've only done about 30 crores so far. And so therefore, you need to vaccinate. I think we are vaccinating more and more. I mean, in the last 2 or 3 days, the numbers have been encouraging. So I think if we can vaccinate 30 to 40 lakh people every day for the next month, and then ramp it up to 90 lakhs to 1 crore a day, I think we can get there. Now, there is a promise of manufacture of or availability of 12 crore Covishield vaccine doses in June. And there is a promise of probably 7 to 8 crores a month by July of Covaxin. So, and we've heard Dr. Ganguly tell us the other arrangements which the government is trying to make with the mRNA manufacturers and J&J. So I think all in all, the 3 vaccines that we already have and the others put in, if we can go at top speed in the next month to 30, 40, 50 lakhs a day, and then when we have more vaccine stock, we get up to 80 lakh to 1 crore a day, we can get there. Now, as far as mixing and matching, you were talking about that before the break. As far as mixing and matching vaccines is concerned, I mean, we all know that there have been trials in Spain and UK, the CombiVac study in Spain and the ComCov 1 and 2 studies in UK, where they've tried to follow up Covishield with mRNA vaccine or Pfizer vaccine. And they have been successful in administering those without side effects. So this is safe. And they've also actually seen added protection with an increased level of antibodies after this combination. This has already happened also in Germany and France by default because they stopped administering Covishield to people older than 55 and 60, and then they had to follow up the first dose with Pfizer. So there are several examples abroad, but none of Covishield and Covaxin, and a combination of Covishield, Covaxin, and Sputnik is waiting to be done in India. It must be done because it will ease logistics if we can actually call people in for any first shot and any vaccine second shot. And, obviously, if the doses of one vaccine are over and you can actually mix and match, and you've shown that it is safe in a trial, then it will help us vaccinate people faster. But I must say that from a scientific viewpoint, a trial has to be done of this crossover. And I'm very encouraged to see a government announcement on that they're going to start a trial on the mixing of vaccines within the next month.
Dr. Dasgupta, your views on whether mixing of vaccines is one option to make it stretch further? Is this talk of only 1 dose of Covishield something you welcome, or do you see it, with a pinch of salt?
No, as far as these 2 alternatives are concerned, there is already encouraging evidence from other parts of the world, including the AstraZeneca first dose data. And Dr. Arvinder Soin certainly expanded on those. I think what the Supreme Court could have pushed a bit on is going beyond this numbers game, is not just whether it could be achievable in terms of numbers, but whether it would be achieved equitably enough, given that it's such a large population and the whole exercise is going to stretch over a year, even in the best case, the first dose that is, sorry, the first 2 doses that is, and perhaps a little beyond. Now, I hope the Supreme Court would have been guided by the WHO's value framework of September 2020 as a precursor to planning, allocation, and prioritization strategies, where they actually consider a very wide range of risks and going beyond what India chose to do. It highlights the needs of employment categories that are unable to physically distance, social groups who are unable to physically distance, such as custodial populations. Today, and it's only today, as late as today, that one High Court has actually ordered a 90-day parole for under trials, and in fact, most of the under trials, barring some categories. It also highlights that workers in non-essential but economically critical sectors who can't physically distance be prioritized. It also considers important essential workers outside the health sector to protect the continuing function of essential services, which includes, among those whom we haven't, teachers, childcare providers, and most importantly, agriculture and food workers. And finally, in terms of equity, achieving equity, it talks of hard-to-reach populations and geographically vulnerable populations, including those in conflict areas. So that's the equity lens that the WHO had urged member countries to focus upon. And therefore, I repeat, it's not really the numbers game, but whether we will be able to do equitably enough and actually prevent many from among these categories who would perhaps be facing complicated disease, if not death.
You know, this is a very important aspect in the context of what we're talking about. And Dr. Babu, let me ask you to come in on this. So, for example, the Chennai Municipal Corporation is going door to door to get to differently abled people who need to be vaccinated. It's been left to the states and then to individual district and local administrations to prioritize. That's the plan right now. Do you think that works? Is that the best approach when it comes to equitable distribution of vaccination, where you let the local authority decide who they think needs to get vaccinated? Right now, what we're also seeing, just as an aside, is that because of more supply coming into the private sector, you are seeing that those who are better off or digitally more savvy nosing ahead.
Yeah, Tamanna, I'm thankful to Dr. Dasgupta for bringing equity as the most important determinant of vaccination. But by design, the way the program has been thought of is inequitable. If you're expecting people to register on a smartphone to get vaccinated, we are creating hurdle even before people come and get vaccinated. Now, just to give the context, nearly 50% of the people do not seek healthcare in public facilities, even when they can have access. More than 60% seek from private health facilities only when they have affordability. When you know that this is the context, how would we expect people to be really so health conscious that they know that they have to get vaccinated? They'll go and register on the smartphone. If the app doesn't work, they'll keep repeating as many times as possible. And then they will get vaccinated on the day when they're scheduled to do it. We are trying in several programs, vaccination programs, by doing outreach nearer to their homes. Even there is dropout rate where ASHA workers will have to go and mobilize. So what is the solution? Solution is very simple. We have to have a two mode of doing the vaccination program. Bulk uploading of eligible participants will have to be done by the ASHA workers, by the ANMs and the urban health system. At the same time, there should be outreach sessions to ensure that there are no adverse effects, because we also need to monitor for adverse effects. So as much as possible, we need to have these health personnel in the periphery doing the vaccination and ensuring that we have to monitor for adverse effects. To do this, numbers are very important. Even for equity, numbers are important because we have to cover around 10 million doses per day to cover 2 billion doses by the end of this year. And that should start from tomorrow, 1st of June, which means that we have to secure the supplies and then plan a program by strengthening the micro plan and mobilization campaigns. Over-reliance on the CoWIN app is definitely a hindrance for a successful coverage, and this beats the equity. Over to you, Tamanna.
Dr. Soin, let me come to you on some of the questions that were raised by the Supreme Court. Do you think that there is now a case to review the vaccine policy as it stands? And some of those things were procurement for the age of 45 plus by center, while states and private take care of 18 to 44. The basis of that was that more people in the age of 45 plus were catching the virus or were dying from it. Do you think the data now shows us that we need to look at 18 to 44 or other segments also as carefully, and that whole procurement policy needs a relook?
Well, I think the part of the procurement policy that first needs a relook is the fact that the states have been given the permission to float tenders and seek the vaccine from abroad directly. I think it should be done by the center. So that's the first change that needs to be made. Secondly, as far as the age group distribution of vaccination is concerned, I think the government were absolutely right in actually prioritizing people older than 45, because even though we've gone on about how younger people have suffered more in the second wave, the majority of the mortality at about 65 to 70% still stands among the older people. But as more vaccine stock becomes available, yes, the policy should be reversed and equal amount of subsidized and free vaccines should be given to all age groups, and the differential in pricing should actually cease. However, 25-30% of the vaccine will still be sold to private institutions to administer on paid basis. So this shift in policy can happen once there is more vaccine stock. But at this point in time, the rationing to more than 45 years of age is actually okay for the next month or two.
Dr. Dasgupta, moving ahead, how do you think we should look at the vaccine policy? Do you think that this differential pricing in private, differential pricing in government hospitals is working out? Because the private sector right now has more supply, so people who have access to this are perhaps at a better chance of getting vaccines. Does that concern you, or are you of the view that whoever can get vaccinated right now is good, the more the merrier?
Of course, it concerns us, and it should concern the collective conscience. One national newspaper actually published somewhat of a back-of-the-envelope calculation of out-of-pocket expenditure should a family should an average family choose to vaccinate. And for the lowest income group, which is available from NSS, this could amount to anything between 40 to 90% of their monthly expenditure. And that should worry our collective conscience. The other thing to remember is that in this country, it is always the union ministry, the immunization division to be specific, that's always procured vaccines from the global market. And vaccines are constantly procured from the global market. Vaccines have always been an oligopoly game. And there are, if I may, certain rules and tricks of this game. The states, let us recognize, have never played this game. States actually buy very limited amount of vaccines, such as rabies vaccines, or maybe the odd JE vaccine, even in limited pockets and contexts. But as far as the bulk vaccination program goes, it's always procured and distributed by the center. The logistics the architecture of the logistics is arranged that way. But states simply do not have the experience of buying vaccines from the global market. And that's something which certainly worries me.
equitable distribution is important. Maybe we need to relook at some aspects of procurement as well, important questions that are pending in the top court right now. But I think there is no doubt that we need to race ahead with the vaccination plan. Putting all differences aside, we need to make sure that enough Indians are vaccinated, and if December 2021 is the target, so be it. Let's get there as soon as possible. I want to thank all of you for joining us on this discussion.